Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, the legal and government correspondent, and today, medical correspondent. And with me is a return guest, Dr. Paul McGinnis, a friend and fellow Rotarian. So Dr. McGinnis, welcome to the show.
Well, thank you, Jamie. Glad to be. I guess I'd say glad to be back, but I'm not sure. I'd rather that this thing be over like everyone else.
That's right. I can't remember the month that you were here, but you've been my guest at least once, explaining where we're at with COVID. And we're now taping this December 29th, 2021. So we're roughly into month 21 of the COVID being in the United States. We've got a variant, Omicron, that is starting to take hold, and we are seeing numbers shoot up. So I wanted to start the show, this is going to probably play for the next month or more, because we are just coming up on New Year's, and folks have just gotten done with Christmas. So what should they be doing if they are planning get-togethers with folks that are outside their own household?
Sure. Well, I think there's several ways you can gather and decrease the risk. I mean, nothing is 100%, but there are ways to really change that risk profile. One is the use of masks. So if you're gathering and you're comfortable with the use of masks, you can certainly do that. The second and probably actually most important one is actually vaccination. So everyone in the group vaccinated, boosted, the risk goes way, way, way down. And again, in medicine, we talk about layers of protection, same as the airline industry and trying to make sure you're safe to fly. They do lots and lots of layers of protection to make sure that you're protected adequately. And so we talk about layers. So vaccination, boosted, are the first two layers. Second layer would be masks, if need be. Third layer would be something like a test and finding out, is there anybody who has asymptomatic COVID or isn't aware that they have an early case of COVID, and looking for that. So that's another way that you can do that. Making some decisions about risk. So if you have somebody who's at high risk, maybe the gathering is a little smaller. Maybe it takes place in a different way. If you have folks who have made decisions to be unvaccinated, that's a higher risk, and you're going to have to assess that as a family and as an individual.
Okay, so number one, being able to obtain the vaccination status of your guests and know that is helpful. If you can ascertain that, then the assumption should be that they're not vaccinated and precautions taken.
Yeah, I think that's the safest. And again, that's a hard question to ask, but I don't think that that's an unfair question to ask. And if somebody's not comfortable sharing that, that's perfectly fine. That's certainly their right and their privilege. And then you as an individual should have thought that through ahead of time about how you want to address and handle that situation.
Well, given where we're at, we're going to talk a fair amount. Today's show is going to be less about the vaccination, although we talked about that in previous shows quite a bit, and more about the testing. You've brought with you a test kit, and we're going to actually administer some tests live on the air, and then we're going to continue in real time our interview and see where we go from here. So
see what develops.
Now, this is a test kit that people can buy in the stores or online.
Correct. It's called the Binax now. It's Abbott. It's what's known as an antigen. So it says right there, antigen self-test. And it's also known as a lateral flow test. This is not a PCR test or a molecular test, so it's a little less sensitive, a little less specific, okay, than those tests would be. But it's one you can use at home.
A test like this is not going to tell me whether I have the Delta variant or the Omicron variant.
No, it will not. It will not. You can only do that by genomic sequencing, and that's big pieces of really expensive multi-million-dollar equipment. So, no.
Okay. So, do you want me to? Can I take my mask off to get the test?
Let's do that. I'm going to clean my hands off because we're going to do this. And there's another one that's commonly available called Illume. That's by Bendix-Dixon. Both of these are well-known companies that have been making tests for long periods of time and are well-known in the testing and medical communities. So, and there are some others. So some of the tests you end up sending in, and you get the results within a day or two. Other tests you actually do, and you can get the results in about 15 minutes. This is the 15-minute test, so this is great for your party right before or things like that.
Okay.
When my family and I gathered for Christmas, we actually, a fair number of folks got PCR tests within a day or two before the event. Some folks did an antigen test right before the event. So when we gathered in the home, we knew everyone had been vaccinated, boosted, and had negative tests. That made it very comfortable for my in-laws who were in their upper 80s, and for my grandson who's under 6 months and so doesn't have the option of even making a decision on vaccination.
Right.
So when you get these kits, a couple things to look at. First off, all kits have a manufacture date and then they have an expiration date. And these kits only are good for about 6 months. So don't stick it on the shelf and leave it forever. After that, results are not reliable.
And you know, we've seen throughout the pandemic, whether it's supplies, food, toilet paper, people hoarding. This probably would not be a good thing to hoard if it's got an expiration date on it.
Right, yeah, you're not going to hoard this for 6 months. You want to buy the quantity you might need in the next couple, 3, 4 weeks. Right now, they're tough to get. I have found them on Walgreens' website. I've occasionally found them on Walmart as I've been looking around. So, but what they basically are is...
And I want to tell the folks that are watching that I am asymptomatic, I'm vaccinated, and I'm boosted.
Yep.
And I'm very comfortable with Dr. McGinnis as a retired medical doctor administering this test now. But people don't necessarily need a medical degree to do this.
Oh, no. Just follow the directions. The directions are right here. They're very specific. They're actually printed on the inside. You do want to pay attention to what they recommend because that makes your test more accurate. You don't want to skip steps. That's going to make it inaccurate or potentially give you an erroneous result.
Okay.
So that's what these little kits are, the test. This is the strip that you're going to be reading eventually, and we'll talk a little more about that. But basically, you just open them up, lay them down. This is going to be yours, this is going to be mine because we're both going to do it.
Okay.
Then you open up one of these little, whoops, first we got to do this. Take out a little liquid here, and you're going to put 6 of these drops in the top chamber. There should be one more here, Jamie.
Okay.
So in your top chamber, your small chamber, you're going to put 6 drops. Make sure you get all 6 in there. And if you miss, put in a 7th.
Chamber.
Mm-hmm.
Okay. So meaning the larger of the 2 holes?
Nope, the smaller.
Smaller. Okay,
Yep.
got it.
And if you miss with one, just add another drop.
Okay.
When we were doing some testing with a bunch of folks, we discovered that
3.
not enough fluid was one of the big problems.
4, 5, 6.
There we go. All the rest of this is waste, and
Okay.
this can just be thrown away as well. What we're going, next thing you do, and I'm going to make sure I cleaned off my hands. I think I did this before I started this process, but that should be the
Yeah,
case.
I did so off camera, but
Yeah. So when you open up the little thing, grab it. The top has usually got a couple little things on it. You peel it down.
Okay.
There's a foam tipped end. That's the one is at the bottom. That's down here. Pull it out and you can see that foam tipped end. Okay. Goes in the nose, about 15 seconds each side. One of the tricks is this just goes in the front part of the nose. So just about this part where you have the foam, that's the only piece that goes in. It doesn't go way back like sometimes we do in the doc's office. This one's much more comfortable. It's only right there.
okay, good.
That's the first thing. About 15 seconds each side, a couple rotations because you want a lot of good stuff on it. Okay. And then the other trick is that most people, I'm going to take my mask down too, most people assume that the nose goes up like this. It doesn't. The nose actually goes straight back like that. So if you're helping somebody or doing this on somebody, direct it back towards the ear level, okay? And you want to go straight in, slightly towards the ear on that side, just slightly, and straight. So you can see I'm nice and straight there.
Yep.
That's going to make it a much more comfortable experience. If you go up like this, you bang into things that are really sensitive, not as comfortable.
Okay.
Okay?
All
So that works really well, especially with little children.
Okay. And hopefully you're okay with your mic there.
Yeah, it just fell on the floor. There we go. You ready?
Yes.
Okay. That's about 15 seconds. We'll go to the other side.
So you use the same swab.
Yep. There we go. And that's all done.
Okay.
I'm going to give you this swab. Put it in the lower, larger hole,
Okay.
and you're going to push it under the bridge into the top hole.
Like that.
Yep, and then spin it 3 times.
1, 2, 3.
Okay? Peel the little tape off here.
Okay.
Close the lid. And just push it down so it seals nicely. And then we're going to wait for about 15 minutes.
Okay.
Okay?
So mine's done.
Yep.
Now I'll remask just in case.
Yep,
I'm
one
not
of us turns out to
expecting
be
it to
positive. Neither of us, none of us are.
Yeah.
So you can also do it on yourself. So I'm going to do it to myself here.
Okay. And I'm glad that it doesn't go as far up because I remember my very first one, more than a year ago, and it felt like it was going up to my brain.
Yeah, yeah. And those get awfully close. And when you've done a few of those deeper, what we call a nasopharyngeal swab, you learn how to do these really, really well.
Okay.
So again, I'm going to slide it underneath. And if you see a spot of blood, don't worry about it. The test will still be perfectly accurate.
Okay.
Okay?
Yeah, I was a little concerned for that only because I've noticed with the dry weather, the fact that I'm also on blood thinner, bloody noses can happen, but that's good to know that a small amount is not going to affect the test.
Yep, so we're going to go 15 minutes, so shortly after 5:15, 5:14, we should be able to find out how we're doing here.
Okay, great. And that'll be while we're still within our time limit. So, Doctor, we've just demonstrated it's not very hard to do the testing. Certainly helps to have a medical doctor explaining it, but now it's one of those things where they can just read the directions. There's going to be multiple manufacturers of these, I presume, in different brands.
Yep. Yeah, so Illume is one that's Benedict-Dixon, and then this one by Abbott, which is known as the Binax Now test. And then there's a few others out there.
So these that will be, I call it over-the-counter. By over-the-counter it also means that they can get them online and mailed to them. You mentioned antigen versus molecular. And so just briefly again, the antigen test is basically, what's it looking for in order to come up with a positive or negative result?
Yeah, so they're all looking for pieces of the virus, okay? The antigen test is looking for slightly different pieces and slightly larger pieces and a more consistent, intact viral structure. The PCR test is looking for very specific patterns of RNA, because this is an RNA virus, and it's looking for a compilation of several different types of RNA, specific RNA chains, and then it amplifies that so it's able to be detected. So that's why the molecular test is more sensitive. These are a lot easier.
Okay.
They require a lot less reagent. The reagents are easier to process, and you get a reasonable result. So they're faster and easier.
Any stats on like false positives, false negatives for either of those?
So the PCR test has a very, very, let's put it this way, is highly precise, very, very accurate. As a result, there is a risk of false positive tests if you've recently had a COVID infection. But it is also better at picking up a very early COVID infection.
Okay.
These tests are less likely to do that. They're not as good at picking up a very, very early infection, but they may also turn out negative when you have that early infection, so that would be a false negative. Then you also get into, okay, how much disease is in the area, how well was the test done? There's lots of other factors that go into that. Long story short, they're both pretty reliable tests. The PCR is much more accurate, but could remain positive for up to 90 days after an infection.
Okay.
These tests are less likely to remain positive for that long period after an infection. And there's been some question about whether these tests could actually be used to clear somebody and say, hey, you're no longer infectious, you're good to go. The problem is the FDA has not really certified them for that usage, and the research at this point is fairly sparse on that, so it's not as reliable. If you want to take a chance and see what you can do, you can always check it and see, but the results aren't as reliable as we would like.
Got it. And so I'm going to use my family as an example because I have 4 brothers in multiple states, and we were all going to get together for Christmas. I've got a father who's over 80 years old and would be sensitive, obviously, to COVID and potential complications and so forth. So we all agreed that we wanted to try and stay healthy and minimize our contacts with others, so forth. But yet my brother still turned out he tested positive on Monday night. So that was one brother that was definitely out. Then when he said he was out, I had another brother in another state who said, well, I've been symptomatic for 4 days and it's hard to get in to see a doctor and or get tested. So with that, we kind of said, let's just postpone everything a couple weeks. Should we be safe pushing things out 14 days if we've got 2 symptomatic people, one that tested positive, one that's still waiting to get tested?
Yeah, so in that situation, I would say chances are that those individuals would no longer be infectious, okay? Your brother who is not tested but had symptoms, it could have been a cold, it could have been coronavirus, it could have been influenza, it could have been a variety of different things, we don't know. And so, but if his fevers are gone, his symptoms are resolved, at that point, he's no longer contagious. And the same thing with your other brother, 2 weeks, he should no longer be contagious. Now the question that really gets to the heart of the matter is, did somebody else happen to pick it up in the meantime?
Right.
So again, for the brother who has never been tested, I would suggest that he test prior to the gathering, either a PCR test or probably in his case an antigen test would be sufficient. Okay. Because if he happens to have had COVID, a PCR test might give him a false positive, causing everyone to worry when they didn't have to.
Okay.
For the other family members who haven't been had a known exposure and don't have symptoms, you could certainly go ahead and do a test like this to be on the safe side.
Okay.
And again, assuming vaccinated, boosted, risks go way down.
Let's talk about timing of the tests, because there's so much information out there and disinformation. Okay, so let's say you're planning a gathering like we were. We were going to get together for New Year's Eve, and today is Wednesday.
Sure.
So today would be, in fact, that I'm being administer, would be a good day to find out whether or not I can get together with somebody this coming Friday night in 2 nights.
That would be pretty good. If it were a PCR test, I'd be more comfortable because a PCR test is going to pick up your very early disease. So if you'd gone to the clinic or if you'd requested a saliva test from the state or gone to the county testing site and gotten a PCR test from any of those, at that point you'd get the result back in usually a day or 2. And when you have that result, you can be pretty comfortable that you don't have something that was early on. This test is not going to be quite as good. It's still better than nothing by a long shot because we know up to 40% of people can have COVID and not have symptoms. And so this test is going to at least provide some level of reassurance that as of this date. This would be better done, say, an hour or 2 before the event.
Oh, that close?
Yeah.
Okay, so we could just repeat this on Friday.
Yeah. And actually the ideal way to utilize these tests is to do them initially and then repeat them in 24 or ideally 48 hours. And that gives you a pretty good handle that something didn't brew up in between, that it got missed on the first
Or you could
day.
isolate yourself, right? I mean, if you're not exposing yourself to anyone and you test negative.
Yeah, the risk here is that you tested negative, but you had early COVID.
Okay.
You could be just in that because you could have been exposed, say, yesterday, not yet have enough virus to be detected by this particular test. Tomorrow, you might have plenty of virus to be picked up by the test.
Okay, now, you, before the interview here, you sent me some things, because there's different guidelines for different sets of people. There are folks who are obviously unvaccinated, is a whole separate one, but there's vaccinated and boosted, vaccinated and not boosted. But let's assume vaccinated and boosted, but yet symptomatic, okay?
Okay.
So if your thing said test on day 5 if possible, why wouldn't you test right when you get the symptoms?
So let's back up here. What you're talking about are the new CDC guidelines. So let me be clear. If somebody is symptomatic, vaccinated, boosted, unvaccinated, I don't care. They should get a test. Okay, at that point in time, as soon as they could, because you want to pick up that and figure out whether you have coronavirus or not. Some of the testing centers now, like the clinic here in town, will also test you for influenza, RSV, influenza A and B and RSV. So you might have one of those conditions as well, which get treated differently and handled differently. So if you're symptomatic, you should get tested. Doesn't make any difference what your status is.
Don't wait to get tested.
Don't wait. Okay. So
let's say you're not symptomatic, because I just had this situation a month ago at work. We had a couple co-workers who ended up testing positive.
Sure.
And then they figured out, one of them, who I work with rather closely, believed that she had 15 minutes of, with exposure within 6 feet of me, and we had calculated it to be a Thursday. So then they said 5 days out from that, and I was asymptomatic. So they said you should test in that 5th or 6th day. Don't wait more than a week, and don't try to do it sooner than a couple days. Is that?
So you're talking about somebody who specifically has been a close contact, okay?
Right.
And so close contact means that you've been in proximity with someone who is diagnosed with COVID for at least 15 minutes within 6 feet in the prior 24 hours, and it can be a cumulative 15 minutes. So if she was in your office for 5 minutes here, Stepped out 5 minutes there, stepped out 5 minutes there. That's a total of 15. At that point, you'd be a close contact.
In a typical work day, right?
Yep, yep.
8 or 9 hour work
What,
day.
24-hour period.
Yep,
So-
24 hour, okay.
Yep, so if she was in your office twice on the afternoon and once in the morning, that counts.
Okay.
Okay? In those situations, the old guidelines recommended 14-day quarantine,
Yep,
or you can shorten it to 10 days if you are asymptomatic, or you can shorten it further by a test on day 6 or 7, okay? And the counting started on the day after your exposure, okay?
okay.
If you were vaccinated, okay, so, and you are, then in that case, there is not a requirement to quarantine. You don't have to stay home, but it is strongly recommended you test on day 3 to 5 to find out, do you have it or not? And that should be a molecular, a PCR type test, okay?
Okay.
The new guidelines that came out a couple nights ago and caught a lot of...
These things
a
are
lot of folks-
changing,
yep.
so it's
Got a
good.
lot of folks by surprise, and there's a lot of conversation about whether it's a little too lax or a little too, and there's some back and forth in the medical community, as there frequently will be. Says that for a individual who is a close contact or otherwise is quarantining, if you are unvaccinated, okay, you should wear a mask. Let's back up. If you're vaccinated, okay, you should wear a mask for the entire 10 days. Good mask, wear it for 10 days whenever you're out of your house, okay? Now, if you're outdoors by
Within
yourself...
10 days of that close contact.
Yep, for the 10 days following that close contact, with the day counting starting on the day of your contact. One slight change. So the day of your contact, that's when you start counting number 1, okay?
Okay.
And you wear the mask for 10 days, and you test with a PCR test on day 5,
Okay.
okay? If you are not fully vaccinated, okay, so if you've had 1 dose instead of 2, or if you've had 2 doses and are eligible for a booster but have not had it, or you've had Johnson & Johnson and had not had a mRNA booster, then at that point you're considered not fully vaccinated. That's, again, a slight change in definition here. And in that case, what you need to do is you need to stay home for 5 days, okay?
Okay.
Test on day 5, and then you're allowed to, if that test is negative, resume your usual activities with a mask on for the additional 5 days.
Okay.
So if you're close contact, you mask for 10 days, period, it's just done, okay?
Right.
If you are not fully vaccinated, you stay home for 5 days, and then you can go out if your test is negative. In both cases, you test at 5 days, because we want to find out if you got COVID from that exposure.
Okay.
If you're not fully vaccinated, your chance of getting COVID is much higher than somebody who is fully vaccinated, as you and I are, because we both had both vaccines and the booster.
So I think it bears repeating, and just if it can, that's a great explanation, but people hear the first part and then they don't always hear everything else. And what it comes down to is that with Omicron, and let's talk a little bit about how that compares to Delta, but with Omicron on the rise, cases are definitely surging. The number of, or the opportunity for having close contacts is going to go up.
Absolutely,
and so,
yes.
If people have missed work, missed school, missed events because there was a close contact, that potential is going to only rise now. And so I think people are going to want to try and what can I do to minimize my loss of work, my loss of school, et cetera?
Frankly, I think that was one of the reasons, and also some science, that the CDC came out with these new guidelines, because we know that folks are most contagious in 1 to 2 days before they develop symptoms, and contagious for 2 to 3 days after they have symptoms, after they have a positive test. Individuals who are vaccinated are contagious for a shorter period of time. Individuals who are not fully vaccinated are contagious for a slightly longer period of time. So what CDC has done is tried to say, hey, Omicron is here. It's sweeping. We're going to see case numbers significantly and dramatically increase, as we already have, and I think, frankly, it's going to go higher. And so they're looking at it saying, hey, we need people to be doing the jobs that need to be done to keep our society going, our economy moving. And so they shorten things down to give people more latitude, so it's 5 days now. Now, one of the things we didn't talk about is if you test positive, you mask for 10 days.
Right.
You stay home for 5, irregardless of your vaccination status.
And irregardless of symptomology.
Correct.
Okay.
Correct. If you have symptoms, say it gets to be day 6, and you still have a fever, you stay home. If your symptoms are not getting better by day 6 or 7, you stay home. So we're really looking for people to be on the mend, no fevers in that 5 days, and wearing the mask for another 5 days, because there's still a slight chance you might be spreading some virus, and the mask isn't going to make it makes a significant difference in that.
Would you agree with this? I mean, after having read all these pages and everything, that what it comes down to is, number one, we can do things to strengthen our immune system.
Yep,
Getting
definitely.
vaccinated, boosted, eating right. There's
Yep.
people that talk about supplements for C, D, zinc.
All those three can make a difference. D, we're more deficient in, especially males like you and I, especially people who live north of the 45th parallel, which is in North Hudson, so we're awful close.
Yeah.
C, not a bad thing. It's not going to hurt you. It's great. I like the natural forms of C, like an orange,
Right.
as opposed to
Right.
a pill. That makes a difference. Exercise makes a difference in your immune system. Rest makes a difference in your immune system. Handling stress makes a difference in your immune system. So those things are also helpful. They tune it up so that you're ready to go. I think the vaccines provide a lot of extra training for immune system, so it's ready to do what it needs to do, and it knows exactly what to do, as opposed to making it up as it goes, which is what
Now,
you do.
one thing that I've heard, now this is anecdotal, obviously, but I heard from some people that the first vaccine shot was their worst reaction. I heard from other people, no, it was the second one that I felt more. But regardless of that, the people who have had the boosters, they said, I barely felt the booster. I didn't have any effect from the booster at all, so I'm worried that it didn't do the same job because I got worse effects from shot 1 and 2.
Yeah, so the answer to that one is no, is that booster's still going to do its job even if you didn't have side effects. So side effects don't correlate with the efficacy of the vaccination.
Okay.
So, and that's really important to understand. Also, the third dose does a better job of building immunologic memory. And so that second and now that third dose builds a lot better immunologic memory, so your body remembers longer. Will we need a booster in 6 months? I don't know. Maybe, maybe not. Will we need it in a year? I don't know. Maybe, maybe not. We're just going to have to see.
And it's not just Omicron. I mean, the common cold is still out there. The influenza
Yep.
is still out there. So we want to continue that conversation, but I just noticed we're at 30 minutes. So what is our...
So here is my test, and you can see two things on this test. So first off, you can see that there's a little pink line across the top.
Yes.
Right next to it, you can see something that says control.
Yes.
That means the test worked.
Okay.
So you always want to have that control line. If you don't have a control line, you can't take any results away from that, okay? If you notice below it, there's another little spot, and there's no line there.
Okay.
That means I don't have COVID.
All right. Then that would mean that mine turned out same way.
Same way.
Okay.
One of the things I've seen sometimes is you'll get kind of this pinkish hue that is kind of all over this lower sample area. If that happens, it means that the test probably really didn't work that great.
Okay.
And I would repeat it.
So you don't have a sharp line, it's just a pinkish hue. That's not going to...
Can't say anything about it. Don't know.
Inconclusive.
Inconclusive.
All right,
exactly.
given that we're both negative, now we'll be able to conclude the interview without masks.
Without the masks.
And that's good. But we could avoid having to have any masks in our encounter today in this interview had we done this off camera an hour ago or so.
If I'd done this in my car before I came in. Oh, one thing I do recommend these tests be at room temperature.
Okay.
I haven't seen data to say that they're really good hot or cold. So room temperature, they should be at room temperature for a little bit before
Considering it's somewhere in the single digits out there today.
Yeah, and I wouldn't let them freeze, because I think if they freeze, the test is not acceptable.
So if you buy them at the store, get them home, get them in the door fast if you live in our climate anyway.
If Amazon delivers them, make sure you get the box off the front step.
Yes, yes. I noticed that we had a FedEx package this morning, and I was able to get it off fast because it is cold out there. So,
Yep.
a couple other things. Bottom line is, if you have symptoms, don't wait to get a test result to know whether or not to stay home. You should just be staying home regardless.
If you have symptoms, stay home until you have a negative test, and then you can make some decisions from there. We always recommended, even long before COVID, that if you have a fever, you should not be at work. You should be home.
Right.
Until that fever goes away.
That was a great question. What are the worst symptoms? Number one is fever, right?
Yeah. Fever means you're probably contagious. That's just a safe, reasonable, is it that perfect? No, it's not, but it's a safe
Now, if
bet.
you don't have a thermostat or one of those things you put on your, forehead,
yeah.
is like feeling chilled, is that kind of an indicator you might have a fever?
What I tell people is I would look at how your symptoms are progressing. If you're like, wow, today's a lot worse than yesterday, you shouldn't be going into work. If you're going, well, I'm about the same as yesterday, I'd probably still stay home. If you're going, wow, I'm feeling amazing, probably reasonable to go back. Wash your hands, and frankly, put a mask on.
Right.
These things work not just for COVID, they work for influenza, RSV, whooping cough, colds, all that other stuff that's out there. So wear a mask for a day or two until you really feel like you're back to normal. Not a bad way to protect your coworkers.
Exactly. The coworker that ended up having a positive test stayed away the entire time. She had symptoms, and when her symptoms stopped, she came back to work, but even after coming back to work, wore a mask for another 5 days after she was symptomatic.
Which is exactly what the CDC is recommending. That's just taking good care of the folks around you and being cautious.
Right.
Yeah.
I mean, and it's something, as an employer, I would prefer to do some, personal choices and have those personal choices protect everybody rather than having to incur or invoke some type of, mandate and so forth. Hopefully people are taking safe practices. The big one, don't go to work if you're sick.
Which is what I told people 30 years ago,
Right.
and 20 years ago, and 10 years ago, and 1 year ago. If you're sick, you should stay home.
Okay.
Yeah.
Now, COVID can still be spread by folks without symptoms. So that's where these tests come. I was looking at my mask. The tests come in handy.
Yeah.
Is that if you're not feeling symptoms, but you want to be sure, take a test.
40%,
Okay.
up to 40%.
And now, what about how are our local hospitals doing? I've heard stories. My brother happens to work for Marshfield Clinic Systems, and he said in their hospitals, I'm not sure how many that is, but just in their system alone, they had 35 people pass away in the last week. So,
Yeah, so the hospitals still are super, super busy. I think if we go back a couple weeks ago, both you and I heard from Christy Yeager here in the Hudson Hospital, one of the director of nursing, and her point was that there is a lot of folks in the hospital sick with COVID. They're having to open up some extra beds. They're having to change their staffing. They're having to adjust some of the surgeries, the elective surgeries. We heard later that same day from Steve Massey up in New Richmond that they were actually had 2 patients on ventilators in their hospital. And believe me, New Richmond and Hudson don't normally do patients on ventilators, but there was no place to send them.
Right.
So their hospital physician, their ER physician, their respiratory therapist worked with the teams at Regents to make sure these patients were well taken care of, but there was no room for them in Duluth or Minneapolis or St. Cloud or Rochester or Eau Claire. And so those ICU beds are still really hard to come by. In our local area, there's been a slight drop off in the last week or so in the number of patients in the hospital. Now, it may be that we're seeing a few less cases, so that might be a positive thing. I'm really hopeful and optimistic that's the case. I also know as a physician who worked in the hospital for many, many years, around Christmas time, you worked really hard to get people home. So your hospital census or count was typically down a little bit just because you were trying to get people home. And a lot of folks were staying home and not coming in with their illness until they got through the holidays and then showing up. So we'll see what happens in the next few days. I'm hoping.
Okay. Well, great. Now, is there anything else? We're kind of beyond our 30 minutes, but we just definitely wanted to show folks the importance of tests, how simple it is to perform a test, get one and have it done. And it just provides good peace of mind, and it's just safe practices, right?
Yep. I think the thing right now that has me most concerned, Jamie, is the Omicron variant.
Okay.
We know that that's become the dominant variant across the U.S. It's rapidly approaching that within Wisconsin. We can't test for it on every single patient. We have to do some guesswork based on some sequencing, and we'll only sequence some of the patients. It's much, much more transmissible, 2 to 3 times more than Delta, and Delta was very transmissible, so it's added on top of that. So it's times 2, not plus 2. And the second thing is, while it tends to cause less severe disease, it may cause a lot more disease. So if you have 100 people who get sick with Delta and 5 of them end up in the hospital, you have 1,000 people who end up getting sick with Omicron and say only 4% of them end up in the hospital, you're talking 5 patients jumping up to 40 patients.
Okay.
So even though it's less severe, and that seems to be what the case is, we're still waiting for the science to settle out because this has only been around a month. there may be more people who need that hospitalization simply because it's spread more widely. The other thing that concerns me is people who are relying on having had a COVID infection in the past. Omicron seems to do a better job of defeating that protection. So that if you're relying on a natural immunity or an infection-acquired immunity...
Yeah, if they say, well, I got Delta back in July of 20.
Yeah, you are a prime candidate, and no vaccination, you are a prime candidate for Omicron. They would love to find you.
Okay.
And that's where getting vaccinated makes a difference.
Right.
This makes a difference, both in getting it, but more so in giving it. So if you're wearing a mask, you're much less likely to spread it to others. With the higher quality mask, such as a surgical mask or this is a KN95, not worn perfectly because of my beard, admittedly, but it does do a better job of decreasing the amount of droplet transmission, droplet and aerosol transmission as opposed to...
But any mask, even if it's not certified N95 like this one is not, is still better than
nothing.
And
none of them are as good as the vaccine.
Right, and don't rely on this necessarily for any kind of peace of mind or the fact that you're asymptomatic. Before going into a crowd of folks or having a gathering, it would be better to have a test done. And if it's the antigen, it can be done an hour before the event.
Very simply and easily, just like we did.
Okay.
So
very good. Well, thanks for coming on the show. We can shake hands confidently because we know we're both negative. And I want to thank our viewers for watching another segment of Western Wisconsin Journal. Really encourage folks to be safe. Get the tests so that you can still socialize if you want. People can get back to normal if they just do it in a wise way, and don't just rely on symptomology to indicate whether you can or can't do something, correct?
Correct.
All right, very good. Thank you, Doc. Thanks for being a guest, and we may need you to come on one more time. Hopefully we see this being the last surge, but we thought that was going to be true of Delta. And we did see it going down. It was going down, so that's
June looked
hopeful.
great.
Yeah.
And then Delta showed up. And Delta was giving us lots of problems, and now we're going to have to deal with Omicron. Delta gotten better in the rest of the country. It was still pretty bad in our area, very bad in our area, because that's what we were dealing with in December.
Right,
so,
right.
Hopefully, we'll see.
All right, very good. And again, be safe. Watch more segments of Western Wisconsin Journal for other guidance on other topics as well. So thank you, and Happy New Year.
Same to you.